Hello and welcome to Apollo Clinicals Hospital Autumn CME 2016. Like every year now, this year we have organized this CME spread over 3 days with about close to 800 plus doctors, physician delegates coming over for the CME, about close to 120 faculty giving their talks and spread over 168 different topics. We also have close to about 16 sessions spread over these 3 days. We started off with the emergency and critical care. Primarily we looked at how we would like to do basic life support, pediatric active life support, and also the trauma care, that is the ATLS that we know about. And then we also ran a program which was about the pulmonology and critical care, which had an immense response. On the first day evening, we also had programs related to fetal medicine. We had programs on spine and neurosurgery, and of course we did have a program on interventional radiology. The next day, that is on the second day, we had a program which was dedicated towards oncology in the morning and then gastroenterology in the afternoon. We also had programs in about stroke management that we do at Apollo Clinicals Hospital, and then lastly we ended up the day with an inauguration that looked at about felicitation of 15 distinguished physicians who are there in the community, and also about very special two families who have come forward and provided their ultimate sacrifice, that is that of organ transplantation, diseased organ transplantation. Today, that is on the third day, we are having a packed cardiology conference, laparoscopic conference, and in the afternoon we are going to have also the bariatric surgery conference and on the transplant center of excellence. In a nutshell, this CME is providing us a lot of in-depth knowledge, somewhat like drinking from fire hose. A lot of clinical material that have been shared with practitioners who are coming from all across Eastern India, and that has been the main aim of the Autumn CME. We have looked at showcasing certain elements in this in the CME. Primarily it was about looking at the innovations that we have brought about in the hospital in the past 1 year. We looked at about the technology benefits that we have got in treating our patients. All of these were showcased during the CME. The other aspect in the CME is that we have now formally aligned ourselves with Indian Institute of Technology, Kharagpur, and have started a joint forum on innovation with them. And yesterday it was just a good beginning of the whole process. The idea is to get a very deep insights, firstly with the data processes, the big data associated with healthcare, and how we can use that in our own analysis to get the best out of it. So in a nutshell, we are showcasing this as the different improvements, innovation and sustainable projects that we have done in both clinical and managerial way at Apollo Clinicals. We will come back next year for sure with another CME of this nature, the Autumn CME 2017, and there will be a definite more better bouquet of the kind of cases that we are doing. One of the things that we have done for the first time in part of our digital marketing is that this is the first hospital in India to use augmented reality for communication on a large public scale. First hospital in India to use Facebook Live for conference broadcast, and that is something which is, I've been told, is going globally. This is also the first hospital in Eastern India to use the live YouTube for the conference purpose. So I have just heard that this is probably one of the largest medical need that people can have in Eastern India, but it's just not the size of number of people who are actually coming into this conference physically, but it's also about people who are there in our network and are able to log in from different part of the world to see what exactly is happening around. So we're just trying to spread the word, get a good network of learning clinical learning and sharing it with both our physicians who could not make it here and at large to the public for communication and advancement of clinical education. Thank you very much.